Finding a doctor in some rural communities is hard to do. That can impact people who need health care in those areas. News 10's Joe Ostrowski found out about one federal program designed to get those doctors back.
If you live in a small town or on a farm, getting to a doctor usually means hitting the road and heading into the city. Those miles are long enough to keep many prospective patients from getting the care they need. But in recent years, a growing number of doctors has headed into those underserved communities as part of a federal program called the National Health Service Corps.
They're trying to look at really recruiting those people who have their hearts set on serving those who are hard to serve in some ways. They have a lot of health issues. They don't have real good access to care.
The program works like this. Medical students agree to spend a set number of years working at a community that doesn't have enough doctors in their field. In turn, the federal government forgives up to $60,000 of their student loan debt. For those who work in the program like Dr. Julia Wernz, that money is critical.
In my life, it's been huge. You know, when you start out after school, you unfortunately, a lot of us do have a large debt to pay back.
Dr. Wernz works in child behavioral health at a clinic in Clinton, Indiana. She says despite the financial benefits, her work with the Health Service Corps has deeper rewards.
I really feel like this is my calling. I like the population that we serve. I can relate to them. I'm from a rural area myself, and I feel like it's my people that I'm serving.
And organizers of the program hope that as they bring more doctors through these communities, they'll find more and more who are willing to make themselves at home. In Clinton, Indiana, with photojournalist Tony Casasilla, Joe Ostrowski, News 10.
The program covers general medicine, dentistry, and behavioral health.